Welcome to Norway Perspectives, brought to you by Norway Relocation Group. Imagine this. It's late at night, and something is terribly wrong. A family member is showing signs of a stroke, or you hear a crash outside followed by shouting. In that moment of panic, your instincts take over. You reach for your phone, but then you freeze. What is the number? Is it 911 like back home? Or 999? Is it different for a fire than for a medical crisis? Those seconds of hesitation are precisely what we want to help you avoid. Today, we're going to talk about something that most people don't think about until the moment they desperately need it: the emergency services in Norway. If you're an international resident here, you might carry an assumption that emergency numbers and procedures are universal. But the reality is that Norway has its own distinct system, and misunderstanding those differences can have serious consequences. It can delay the arrival of critical help, escalate a dangerous situation, and in some cases, even put you in a difficult position with the authorities. We are going to delve deep into how Norway's emergency response is structured. We'll clarify the crucial distinction between a true emergency and a situation that requires urgent care. We will break down exactly when to call 113, 110, or 112, and just as importantly, when you should absolutely not call them. We'll address the very real challenge of language barriers in a high-stress scenario and discuss why what you might consider a minor issue is handled very differently here than in many other countries. We'll also cover what happens if you misuse the system and, most importantly, provide you with a clear, actionable plan on how to prepare yourself and your family right now, so that you are ready when every single second counts. Let's begin with the absolute foundation of emergency response in Norway. Unlike the single emergency number like 911 in the United States or 999 in the UK, Norway operates with a specialized three-number system. Committing these to memory is non-negotiable. The three numbers are 113 for medical emergencies, 110 for the fire and rescue service, and 112 for the police. Knowing which number to call is the first and most critical step. Calling the wrong service doesn't just mean you get transferred, it means the entire dispatch process is delayed. A dispatcher for the police has to end the call, and you have to redial the correct number, explain the situation all over again, and re-verify your location. Those are precious minutes ticking away. Let's break down each number. You dial 113 for medical emergencies. This is for situations where life or health is in immediate danger. Think of the classic signs of a heart attack, like a crushing pain in the chest that might radiate to the arm or jaw. Call 113 for sudden and severe difficulty breathing, or if you recognize the symptoms of a stroke. Remember the acronym FAST: face drooping, arm weakness, speech difficulty, time to call. You also call 113 for any serious injury resulting from a fall or accident, for unconsciousness, heavy and uncontrollable bleeding, major burns, or severe allergic reactions. This number connects you directly to a medical dispatch center where trained nurses and paramedics will guide you while help is on the way. Next is 112, the number for police emergencies. This is reserved for situations where there is an immediate threat to life, safety, or property. This means crimes that are currently in progress, such as a break-in or an assault you are witnessing. You should call 112 to report incidents of violence or credible threats of violence. It's also the correct number for serious traffic accidents, especially those involving personal injury or where the wreckage is creating a dangerous obstruction on the road. Finally, you have 110, which connects you to the fire and rescue service, or Brann OG Redning. The most obvious reason to call is for fires, whether in a building, a car, or a forest. But their responsibility extends much further. You must call 110 if you smell gas, as this indicates a potential leak and explosion risk. They are also the primary service for rescue operations, such as extricating people trapped in vehicles after an accident or in a collapsed building. Given Norway's geography, they also handle accidents at sea close to the coast, on frozen lakes, and in cases of acute chemical or pollutant spills. Now that we have the numbers straight, let's address a significant cultural and systemic difference. What is truly considered an emergency in Norway? The Norwegian system is built on a principle of strict triage. Emergency services are a finite, precious resource reserved exclusively for acute, life-threatening, or limb-threatening situations. This is a departure from some countries where emergency lines are often used for a wider range of problems. Let's be very clear about this. If you call 113, the medical emergency line, for a mild fever, a small cut that requires a bandage, chronic back pain that isn't suddenly debilitating, or because you need a prescription refill, you are misusing the service. The operator on the line will not dispatch an ambulance. They will professionally but firmly inform you that your situation is not an emergency and instruct you to contact your primary care doctor, your FastLeg, or the out-of-hours clinic, the legevakt. They may even end the call relatively quickly if it's clear there's no immediate danger, because they must keep the line free for actual emergencies. This isn't just a matter of being discouraged, it's documented. While you won't be formally penalized for a single mistaken call, a pattern of calling for non-urgent issues can be flagged in the system. This could potentially influence how a future call from your number is assessed, creating a boy who cried wolf scenario that you want to avoid at all costs. So, what do you do for those situations that aren't life-threatening, but genuinely can't wait until your GP's office opens on Monday morning? This is where Norway's next tier of care comes in, the legevakt. Every municipality or commune has a local urgent care service. This is the correct place for issues like a child with a high fever and a persistent cough, a suspected bone fracture from a fall, a nasty infection that needs antibiotic treatment, or any illness that worsens significantly outside of normal office hours. To access this service, you don't just show up. The first step is to call the National Medical Helpline number, 116 and 117. This number is free to call from any phone in Norway and will automatically connect you to the legevakt in the area you are calling from. A trained professional will assess your symptoms over the phone. They might give you advice on how to manage at home, schedule an appointment for you to come in, or, in rare cases, escalate the issue if they suspect it's more serious. You can also find information about your local legevakt on your municipality's website or through the National Health Portal, Helse-Norge. Be prepared, however, wait times at the legevakt can be long, sometimes several hours, for non-critical issues. This is a normal part of the Norwegian triage system. They are constantly prioritizing patients based on severity. One of the biggest fears for newcomers during a crisis is the language barrier. When you're in a state of panic, finding the right words in a foreign language can feel impossible. Here's what you need to know. All emergency operators on 113, 112, and 110 speak excellent English. However, for them to help you, you must try to speak as clearly and calmly as possible. The single most important piece of information you can give is your location. You must state your location first before you even explain the problem. If the call drops, they will at least know where to send help. If you don't know the exact street address, describe nearby landmarks, street intersections, the name of a building, or use your phone's GPS or map application to find your coordinates. Crucially, even if your Norwegian is limited, it is incredibly valuable to learn and practice a few key phrases, such as Jeg trenger hjelp, I need help, and how to state your address in Norwegian. This is especially vital if you live outside of the major cities where English proficiency, while generally high, might not be as instantaneous in a stressful situation. If you're calling for someone else, the operator will need a quick, clear summary. Be prepared to explain what happened, the person's approximate age, and their current condition. The most vital questions you will be asked are they conscious? And are they breathing normally? Knowing any relevant medical history like diabetes or a heart condition is also incredibly helpful. Understanding how the system functions behind the scenes can also manage your expectations. In Norway, ambulance services are a fully integrated part of the public healthcare system. This means they are free in emergency situations. You will never be asked for a credit card before an ambulance is dispatched. Dispatch is based entirely on medical severity, determined by the 113 operator using a strict index. This is often categorized by colors: red for acute, life and death situations where response is immediate, yellow for urgent cases that need attention soon but are not immediately life-threatening, and green for non-urgent transport. This is why, if your situation is deemed urgent but not critical, you may have to wait longer for an ambulance. They are not dispatched on a first-come, at the first-served basis. They are sent where they are most needed. In rural or remote areas, this system is supplemented by air ambulances, helicopters, to cover vast distances quickly for the most serious cases. This brings us back to the misuse of services. As we've established, calling an emergency number for a non-urgent matter is a serious issue. It wastes the time of highly trained operators and dispatchers, and most critically, it clogs a lifeline that someone else in a dire situation desperately needs. While an operator is patiently explaining to you that they cannot help with a noise complaint, another caller with a family member in cardiac arrest might be struggling to get through. Similarly, calling 112 for police assistance with minor neighbor disputes or parking issues will result in you being redirected to the non-emergency police number 02800. That number is the proper channel for filing reports about past incidents or for general inquiries. The best time to prepare for an emergency is long before it ever happens. Taking a few simple steps now can make all the difference. First, save all the key numbers in your phone today: 113, medical, 112, police, and 110, fire. Also, save 116, 117 for urgent non-emergency medical help. Create a note or contact card that is easily accessible. Second, if you have a landline, or for the benefit of children and visitors, write these numbers down and post them in a visible place, like on the refrigerator, along with your full home address. Third, download the JELP 113 app. This is an official application that, when used to call for help, automatically transmits your phone's precise GPS coordinates directly to the emergency operator, taking all the guesswork out of finding your location. Ensure your bank ID and Hells and Orge accounts are set up and active. In a medical emergency, this gives healthcare professionals rapid access to your health records. Finally, empower yourself by learning basic first aid. The Norwegian Red Cross and other organizations offer courses, many of which are available in English. Knowing how to perform CPR or control bleeding can save a life in the minutes before professional help arrives. There are also special considerations for different living situations. If you have children, it is vital to teach them how to call 113 and clearly state their name and address. Role play with them to explain the difference between a big problem, where they should call for help, and a small problem, where they should find an adult first. If you live in student housing or any shared accommodation, make sure every resident knows the fire evacuation plan and where the assembly point is. As a group, identify the location of your nearest legevakt. And if you live in a more rural area, familiarize yourself with your local municipality's specific emergency plans. Understand that response times for ambulances may be longer due to distance, and know that this makes your own preparedness, having a well-stocked first aid kit and basic skills, even more important. In the end, Norway's emergency services are professional, well-organized, and highly effective. They are a cornerstone of the country's social safety net, but they function on a contract of shared responsibility. They rely on the public to understand the system and use it correctly. If you know the right numbers, understand the critical difference between emergency and urgency, can clearly communicate your location, and respect the system's priorities, you will receive world-class help when you need it most. If you fail to understand these fundamentals, you risk introducing delays, confusion, and a tragic waste of resources when it matters most. Preparing for an emergency is a fundamental part of integrating into life in Norway. It's not just about learning the language, It's about understanding the civic logic and social structures that define how this society responds to a crisis. At Norway Relocation Group, we help newcomers not just settle in, but also learn how to confidently access these critical services the right way. And at our NLS Norwegian Language School, we focus on teaching you the practical, real-life Norwegian you would need in these exact situations, from making a medical call to speaking with police and fire services. Visit us at norwayerlocation.dot. No for comprehensive relocation support that includes safety and emergency preparedness. And to learn the practical Norwegian you need for everyday life and emergency situations, visit nlsnorwegian.no. Thank you for joining us on Norway Perspectives. Subscribe for more episodes that uncover how Norway really works and how you can navigate it safely and successfully.